Thank you so much, Dr. Conway. The graduates of 2012 have selected one of their classmates to speak on their behalf, Bob Zemple.
Thank you very much, Dean Golden. It's an honor to be in this building at this time with all the physicians, mentors, and especially the class of 2012, and a great honor to be speaking on its behalf. I'd like to take just a moment to recognize all those who helped us get to this point. Our family, especially our significant others, friends, colleagues, advisors. I'd also like to recognize those who cannot join us today, whether due to travel or because we've lost them along the way. We would not be here without you. A wise man once told me, experience is the greatest teacher. I want to focus on some of the experiences our class has had, things we've learned from rotations, and how it shaped who we are, making us, in my opinion, the best class ever. Right, Dean Golden? One of the defining features of our class, in part because of the greater feel of the Midwest, is the strong sense of community. The first experience I will recount occurred very early in first year, and it is a personal one, so I'll protect the identity of this classmate to the best of my abilities. Initially, I was slightly intimidated by him. Actually, that's a lie. I was extremely intimidated by him. 6'2", 265 pounds, quiet, kept to himself, guy from Jamaica. After I got to know this name not to be mentioned classmate, we talked about our early medical school experiences. He explained that pre-meds at his undergraduate institution, he gained the perspective that medical school had great potential to be a long 4 years. Because of these pre-meds, he learned that they could be not considerate, social, or friendly. After starting in Wisconsin, people welcomed him, offered him kind words, and treated him as if they had known him for years. Initially, he said he was a little resistant to this, as by his best assessment and preconceptions, it could not be trusted. However, after a few weeks, he realized that people in the class were genuine, they were being sincere, and actually interested in Jamaica. It is this continual friendliness that drew our class so close and served us so well during the clinical years. Another experience for us related to commitment to each other was the fire during January of 2009. It amazed me how quickly our class banded together to help those who had been affected by the tragic apartment fire. This was during the middle of the first year of medical school, a time of great transition in life, and fellow classmates reached out and offered anything needed to help those with their losses. I'm grateful that all of you are my classmates because of who you are and the identity we have built together. Another bonding experience was the leadership shown in the Dean's Cup. For those of you who do not know, the Dean's Cup is an annual competition, essentially between the health professional schools and the law school, in a number of athletic and academic activities, including fundraising for charity and blood donations. During our second year of medical school, our class's contributions helped the medical school secure a win for the first time in 4 years. The incredible participation and leadership our class showed at each of these events as captains provided the foundation for this victory. This tells me, when presented with a challenge, there is nothing our class can't do if we band together, even against future lawyers. Obviously, there are other vital experiences in medical school. In the first 2 years, we were exposed to massive amounts of information, essentially equivalent to attempting a drink of water from a fire hose. This is a licensing exam. Things get better then, right? Well, sort of. Then we start our clinical rotations. We've had many formative experiences during the clinical years, and I'd like to share a few things I learned, focusing on the third year. Surgery. Eat when you can, sleep when you can, and find ways to occupy your mind to keep you from falling asleep as you hold a retractor for the 5-hour procedure that you already forgot the name of. Internal medicine. Forget the 5-hour case. Put on your Sunday's best and get ready for 6 hours of rounding on just 6 patients. Discussing the finer points of common causes of medical problems in Wisconsin. Beer, cheese, brats. Beer, cheese, brats. Pediatrics. This should be fun. A chance to meet some kids. Kids who are fun in the office, but also exposing you to a different viral code for the entire 6 weeks. And as a bonus, you'll still have the symptoms 4 weeks after you finish the rotation. Also, you probably learned just how fun your life was at this point, discovering that when talking with most adolescents, at this point, you should basically consider yourself celibate. Psychiatry. A time of self-discovery. We learned what obsessive compulsive personality disorder was, learn that you and all your classmates have it, and that you don't want to do anything about it, because it's probably how we got to this point in the first place. Obstetrics, 2 words, shoe cutters. Primary care, one of the first times the residents treat you like a person with feelings, only because they're feeling out your ability to write their notes for them. On the serious side, the core rotations taught us innumerable important things as we progressed to the 4th year. Time management, how to show up for work at 4 a.m. Let me rephrase. Have your preparation and notes done to start work at 4 a.m. The best practices on how to do procedures. What really is the essential information when working on an admission with a patient? How to keep the senior residents happy, well, at least try to. When it is time to get concerned. How to work through stressful situations in a calm manner. No panic, as that is unacceptable. And most importantly, what kind of doctors we want to be. Not just the field, but how we want to learn to care for others. Alas, this brings us to the 4th year, a time when we really begin to grow. We learn how to manage the patient on our own. We learn what it means to be an interdependent part of the healthcare team, functioning within our capabilities to assist the team, which needless to say is a valuable life skill to develop in any field. We learn how to multitask, planning our futures while managing our work with our patients and finding time for family and friends. It was about this time I realized so much of what we learned was through what we did with the structure provided. We learned who we were through many different in-class and out-of-classroom experiences. We excelled at a range of challenges that presented during our time at the University of Wisconsin. And we learned from an exceptional statewide campus that provided us a great experience. However, with the thrills of becoming a physician, we mustn't forget the tough times, because these are the experiences that bring us together and make us stronger. For example, the occasional poor exam score that is okay because of whatever silly reason we convince ourselves. So for those of you who did not get any poor exams, and does not affect Ian, you can leave now. Or personal struggles of any nature, family, health, or even classmates. And even death, ranging from the patients we are following to individuals serving as role models. We all remember the sad news last December of the loss of Dr. Paul Burdix, a great professor and teacher for medical school education, administration of the medical school, especially admissions, and his role in the greater University of Wisconsin. He'll be missed in more facets than I have time to mention. As part of our tribute to the great Dr. Paul Burdix, we will be adding a portion of our class fund to the scholarship in his name and contribute the rest to naming a room after him in our building, the Health Sciences Learning Center, the place that he so loved to teach. After all these experiences, we made it. We made it to graduation. Who would have thought we made it this far? Certainly not my first grade gym teacher, who failed me on my inability to jump rope based on his belief of his tie to future success. But we did make it. We are entering a whole new world, residency, a world of responsibility, responsibility for people's lives. It is with this great responsibility we need to ask ourselves, how are we going to manage in our residency and in our future? I think back to the graduated responsibility we encountered each year at medical school and how it built us up to where we are now. First year, we learned how to acquire information from the patient. Second year, we learned what this information meant. Third year, we learned how to use this information to make care decisions. In 4th year, we learned how to integrate all this into managing a patient independently. Now we are residents. This will be a challenging time of great responsibility, but also need for humility. Today we stand proud. We made it. We are officially doctors. But it will be a challenge, one that I feel we are all well prepared to meet. We are equipped with an education from one of the greatest institutions in the country, and there exists a strong drive in each of us to practice the best medicine possible. Because of this, there is no challenge we cannot overcome. The challenge of residency brings the quote I mentioned earlier full circle. The wise man, my belated grandfather, Bob Zemple Jr., often said, "Experience is the greatest teacher. It just depends if you choose to listen." This short but powerful quote can serve to guide us as we approach residency. I've learned that no person is excused from experiences on a given day. They are coming, whether you are ready for them or not, and both ones that are positive and joyous, and ones that will be considered hardships. Life is not always fair, but it depends on how we respond that matters. Everyone will have experiences, and it depends if you choose to listen to these experiences and take something away from each of them that helps you grow. It is with these thoughts that I strongly encourage all of you to listen to your experiences very carefully as you begin residency. As we progress through this next stage in our careers, I want to leave you with 3 things to consider. Number 1, do not forget about the medical student on your service. We were just there. Talk with them, help them out, and please send them home. Number 2, we shaved Dean McBride's head. That's pretty awesome. And number 3, the most important last words, on Wisconsin.
Thank you, Bob. I would now like to introduce